Tucker.
Steve Tucker, you are on BigFurHat's 99-second radio show.
What an honor to be on this show.
I don't know about that, but we'll roll with it. We'll roll with it. The reason why I'm calling you, and thank you for being here, is because you're my go-to guy to find out if I'm going to jail if I don't have health insurance.
Yeah. Well, if you remember, only a few months before the health care law passed, they were going to try and put you in jail if you didn't buy health insurance. And it wasn't a new law they were trying to create. They were just going to take the same clause that exists in the Internal Revenue Service for tax violators, and fines will accrue, and then after 5 years you actually can go to jail. So they were just going to slide that into Obamacare. And then the Tea Party rose up and said, no, you're not. And 3 months before Obamacare passed, the criminal fines for not purchasing health insurance were removed. Now that presented a unique problem to our statist-in-chief, Barack Obama, because now he cannot threaten you for not purchasing health insurance by imposing criminal fines, i.e. jail time. So he decided that he would just impose a fine, which we all knew was a tax, and we watched him lie to George Snuffleupagus on channel ABC News and say that it was not a tax. After Snuffleupagus read him the definition of a tax, he said, I reject that definition. And then, of course, he said he would apply this fine, which we know is a tax, and if you don't buy health insurance, I'm going to commission the Internal Revenue Service to hold your tax refund if you don't. Now, there's a big problem with that. And that is, how many people, percentage-wise, actually pay income taxes in the United States? About 53% of us. 47% pay no income tax. So how do you hold a tax refund in order to collect the fine if you don't pay income taxes? The people who will be paying for all of this, of course, are the people who they can hold refunds from, and that is the few, the proud, the 53%.
That's right. Now, what happens, though, if I'm part of that 53%, but I don't get a refund?
If you don't get a refund, then there's no way for them to collect the fine, which is precisely why, once again, the largest entitlement in U.S. history will be on the backs of the few, the proud, the 53% who actually do pay income taxes, because that's the only way they can collect the fine.
Now, I'm not going to hold you responsible when I call you from jail and say, hey, the hell, I'm in jail, you told me. But traditionally, I don't get a refund because I'm self-employed. So if I don't buy health insurance, and I'm not going to not buy it because I just want to be a nudge. Some people can't afford it. You know, you just legitimately, for whatever reason, I'm self-employed. There has been a year or two here and there where I did roll the dice and I dropped my health care. Nothing's going to happen to me then if I don't purchase it and I'm not getting a refund.
Every year is going to be assessed as to how many months you paid premiums. In other words, that you complied with this regime. And if you have months where you did not pay for a health insurance policy that is approved by the government, then you will be, it will be an amortized fee over 12 months. So if you had 4 months where you were non-compliant with this regime, then the taxes will be fined and taken from your tax refund. The problem is that the fine in 2014 for not purchasing health insurance is, drumroll please, ready, brace yourself, $95. So obviously I will pay $95 all day long to the U.S. government as opposed to buying a $2,800 on average health insurance policy for a 27-year-old. I say 27-year-old because 27 is 1 year past the failure to launch clause, which keeps you on mommy and daddy's policy to your 26.
So, in effect, with this provision in Obamatax or Obamacare, with this provision that I can't be denied for pre-existing conditions, I'm generally, in effect, paying $95 a year for health insurance now.
Yes, and see, you can get it whenever you want it. So it's much like waiting for your house to burn down and then calling State Farm to ask them for a policy to rebuild that nice pile of ashes. It's the same thing that we're doing this way with health insurance, which is why it failed terribly in Massachusetts, where they allowed you to wait till you're sick to get a plan. You use it for as long as you need that current medical care, and if you don't need any medical care for another couple of years, you can wait, and then you can get it when you're sick again. which means that you're throwing out all of the underwriting guidelines, all of the actuarial tables, because now it's a guaranteed issue situation. But worse than that is community rating, which also now is going to be the law of the land. And community rating is one of the dumbest liberal legislations ever imposed on the health insurance industry, and it has failed in all 12 states it was implemented in. And here's how it works, and you have to think like a liberal. So take a mallet and hit yourself in your temple so you can get down to that level, and then you operate only with your heart, because the liberals think it's fair that everyone should pay the same health insurance premium. That's fair. It makes me feel good. Here's the problem with that. When you're 27 years old, because you won't have claims for many decades, you're young and invincible. The insurance companies know this. So they're going to charge you about $60 a month. When you're 62, you're going to pay over $400 a month. When the liberals come to town in a state and say everyone should pay the same rate, guess what happens when Mr. 27-year-old now has to subsidize Mrs. 62-year-old? Mr. 27-year-old's policy starts increasing dramatically. And as soon as Mr. 27-year-old gets that increase from the insurance company, the next thing he does is he calls the insurance company and says, I'd like to cancel my policy. And so do all his other Occupy Wall Street friends. Now, you no longer have youngins to lower the premium for everyone in that risk pool, which makes the risk pool much smaller, and then drives up the premiums for the poor 62-year-old.
How does this work out? The penalty is $95 no matter where you live. But if you're telling me I have to pick up insurance in New York, it's much more expensive here in New York than it is in, say, Arkansas. So the penalty is the same?
Penalty is the same in 2014, $95 for each individual.
Is that constitutional?
Of course it's not constitutional.
On these grounds, I mean specifically, can the fine be the same for everyone, but the crime's not the same? In other words, I failed to buy my $5,000 insurance policy as opposed to the guy in Alabama who bought, he failed to buy his $1,500 policy. But
you're both going to get the same fine because you both must be equal. You see, we must all suffer equally. So whether your violation is greater in dollar numbers than your friend down the street is irrelevant, because we must all suffer equally under Chairman Mao.
Can we get a second bite at the apple in the Supreme Court under that, or is this done? We're never getting another second.
It's not done.
It's not done.
No, it's not. It's not done. Well, first of all, it's the law of the land. Number one.
Right.
How we stop it? We stop it using the same way that they passed it, and that was the reconciliation bill. It's important for all Americans to understand, if you read the reconciliation bill, that it is illegal for any member of Congress or any congressional body to pass a piece of legislation that adds one dime to the deficit. It must be deficit neutral, or it must reduce our deficit. The CBO had projections showing hundreds of billions of dollars that Obamacare would add to our deficit. They used it. They passed it with the reconciliation process. That's bad. What's good is we can do the same thing. Turnabout is fair play. It does not take 60 votes to kill this legislation in November. It only takes 51. That's it.
Did you have a problem with the law, other than the way it was going to be carried out, either through the Commerce Clause or through taxation or penalties? Did you have a problem with the law that was written itself, with Obamacare? They never went to the Supreme Court to see if the laws were constitutional.
Correct. Correct.
So, do you see anything in the laws themselves?
There could. It depends on what you bring to the Supreme Court. There were 4 separate issues brought to the Supreme Court. One of them, of course, was the mandate. The second was the massive expansion of Medicaid. The other is whether or not you can regulate interstate commerce under the Commerce Clause. And these are the issues that the Supreme Court had to rule on separately. Unfortunately, most of it survived. And then, of course, because he created the new taxing power, it passed. But it's important that it didn't pass under the Commerce Clause. But either way, Roberts betrayed us, joined with the far left, wrote a new taxing power that didn't exist, and this is where we're at today.
Yeah, it was a little bit like a judge saying to a lawyer, do you really want to ask that question? Or do you really want to couch your client's defense just the way you're presenting it to me? He kind of coached along.
Yeah, well, he definitely wrote new legislation.
Yeah, he guided.
He created the taxing power that didn't exist before.
All right, we're up against a hard break. Be right back with C. Stephen Tucker in just a moment. And we're back. We're talking with C. Stephen Tucker about Obamatax. Debbie Wasserman Schultz likes to be carted out on the morning shows, and she'll show up just about anywhere she's going to shill. And she says that the GOP is interested in ending Medicare as we know it. And we see imagery of Grandma being pushed over the cliff by some shady GOP guy. What are your thoughts on that?
Well, every American should know that the Democrat Party with Obamacare has already ended Medicare as we know it. We've all seen Paul Ryan, who was supposed to be that guy pushing Grandma over the cliff, state on every news outlet and every congressional hearing that the Democrats have cut $560 billion from Medicare. And they did do that. They took it from the Medicare Treasury Fund, and they put it toward the largest entitlement in U.S. history, and that is the massive expansion of Medicaid. But that's what they've already done. It is very important that everyone Googles in the Wall Street Journal how Obamacare guts, not cuts, guts Medicare. There were two studies done. One was completed by the American Academy of Cardiology in 2005, and another was completed in 2009 by the University of Virginia. The American Academy of Cardiology study in 2005 produced shocking results. They tried to assess what the likelihood is of a Medicaid surgical patient dying after that surgery compared to a person who has surgery with private health insurance. And the shocking results is that you were 50% more likely to die. Why? Because the doctors who take Medicaid, number one, there aren't many left because they haven't been paid, and you were not getting the necessary follow-up care because, again, the doctors aren't getting paid. So as soon as that study came out, big government had to be applied to fix that. They couldn't possibly have a 50% ratio in dying. So they put more big government on it. Fast forward 4 years, follow-up study by the University of Virginia, and in 2009, you're now 97% more likely to die after surgery on Medicaid than you are with private health insurance. And this is before we add 25 million more Americans onto our already bankrupt program. So, Sarah Palin was crucified for saying death panels. I'm saying that that is one gigantic death panel. And if it's not,